Hello, friends. We are live now. Good afternoon, everyone. Apologies for a little delay due to some technical issues. I'm Himanshu Sharma, joining you live from India. There's a saying, pain changes people. Well, quite literally, it does. Welcome to this edition of our Facebook Live session. Our today's topic of discussion focuses on painkillers and their perils. With me, I have my wonderful friend from Nairobi, Irene, who will be co-hosting this session with me. So Irene is a nurse by training and is currently managing a patient support group. Welcome to you, Irene. Karibu to the session.
Thank you. Thank you.
Well, she is the guiding light to many patients who are seeking honest treatment advices. So she has been quite instrumental in guiding people on the way forward about their treatments. Our specialist and the guest of the day is Dr. Daria Singh, who is the joint replacement surgeon at Zydushospitals in India. He shares a strong connect with Africa and has managed several patients from the region. That includes Kenya, Tanzania, Uganda, primarily East Africa. So he has a very personal connect with the region and all of us. So Dr. Singh has been a regular visitor to the region, and thus his understanding of our people is much better than the most. I and Irene welcome him to this live session. Welcome, Dr. Daria Singh.
Thank you.
Today's session is divided into two segments: the medical aspect of the pain management and then the emotional aspect. So Irene would take up the medical part and I would take the less important emotional part. So Irene, over to you. You are the session in charge now. Please take it on. Thank you.
Thank you very much. And welcome, Dr. Daria, or like we say in Swahili, karibu sana.
Thank you.
So, yeah, so, you know, we've just heard a lot about, you know, your work with the patients in Africa and all that. And I just wanted you to tell us briefly, what is pain and how is it perceived by people, by different people, based on your experience?
Jambo and Karibu to all my friends from East Africa. I'm an orthopedic surgeon by training, specializing in joint replacement surgery. Thus, I deal with chronic pain associated with osteoarthritis of hip, knee, ankle, shoulder, and elbow. There are various modalities I deploy for managing pain associated with osteoarthritis of the joints. These modalities are exercises, medicines, intra-articular injections, and finally, joint replacement if rest of the options fails to relieve pain. So this is my specialty. So coming to your question, what is pain?
Yeah.
And how it is perceived by a person or our brain, how perceives our body this pain is. Pain, the word pain is used in various contexts. Like, listen to these following two sentences. Why so much pain and suffering in this world? The second sentence, what a pain he or she is. So these two sentences describes the unpleasant emotional experience.
Yeah.
Now listen to these following two statements. This man has severe pain in his left hip for 6 days following a fall. She is having pain in her both knees since 5 years due to osteoarthritis. So these two sentences describe an unpleasant sensory experience. And this experience is of varying extent. One patient is feeling extreme, severe pain, and one lady feeling moderate pain.
Yeah.
So if I combine these two pair of statements, then pain can be defined as unpleasant sensory and emotional experience caused by actual or potential tissue damage.
Mm-hmm.
Pain goes much more beyond this. Pain can cause physiological changes as well. There are various physiological changes like it increases the heart rate, it increases the blood pressure, it causes loss of appetite, it causes loss of sleep, it causes loss of libido. So there are various aspects of pain. So that's why pain should be
Yeah.
treated on an urgent basis and on a priority basis and adequately. So now coming to your next part of the question, how body perceives pain.
Mm-hmm.
So this is
Yeah.
a very complex mechanism by which a damaging painful stimuli in the body is perceived by the brain as pain and yet to be fully understood. The complexity of the pain perception
Mm-hmm.
and its varied consequences can be explained by the fact that nervous system is not a hardwired system. Rather, it demonstrates a plasticity which enables it to modify its function in different conditions. When a body part or tissue is damaged, then it tries to protect itself from further damage. Then it repairs the damaged part of injured part through various mechanisms.
Mm-hmm.
One of the mechanisms is inflammation. In the process of inflammation, there are various chemicals which are released, and these chemicals mediators causes a sensitization of pain receptors and nociceptors. Once these pain receptors or nociceptors are activated, they take this information to the sensory cortex of the brain through spinal cord and various intervening part of the brain.
Mm-hmm.
The sensory cortex of the brain then process this information and interpret this information as a pain, and then send this information back to the location where painful stimuli is located. In this whole process,
Mm-hmm.
the pain is modulated by various parts of the brain and spinal cord. Thus, the response is varied, like physical, cognitive, and emotional response to a particular pain stimuli is varied. So this is
Okay.
how the pain is perceived, and it's a very complex mechanism.
Yeah, apparently, I'm sitting here listening to you, and I can almost. So I've been struggling with some shoulder pain. Maybe I look for you after this. Anyway, so and I can imagine when I was going through it, not only so it was physical pain, yes, but it disrupts everything around me, my sleep, how I interact with people and everything. And that's the one thing that keeps pushing me to say, okay, let me take one more painkiller, because I need to put this pain at the back, because I need to do ABCD. So maybe the question then I will ask is, what are some of the random painkillers that people like taking, and what are their side effects, and what's your opinion about self-medication when someone is in pain?
So here, Irene, there are two parts. One is you are taking pain relieving medicines randomly,
Mm-hmm.
then and you are self-medicating it.
Yes.
So when somebody is taking painkillers randomly and self-medicating, so he or she does not know what will be the consequences, and this can be a very dangerous situation. This can land you in a very dangerous situation.
Mm-hmm.
The painkiller is very notorious for causing its side effects.
Mm-hmm.
In gastrointestinal system, it can cause ulcers, it can cause bleeding, it can
Mm-hmm.
cause perforations, it can cause obstructions.
Oh.
Yes. And in kidney, it can cause acute and chronic kidney damage. It can cause fluid and electrolyte imbalance. And in cerebrovascular system and cardiovascular system, it can induce hypertension. It can increase chance of stroke. It can increase chance of myocardial infarction, and it can also lead to or precipitate heart failure.
Wow.
So there are many consequences of non-steroidal anti-inflammatory drugs. One should be very careful while taking pain-relieving medicines.
Yeah, apparently. I mean, I can almost. So, okay, so between men and women, let's start looking at it that way. Who, based on your experience anyway, who can handle their pain better? And, who's likely to self-medicate, or, the random, let me do this and just go? Because I know for a fact that for women, well, by virtue that I'm one, sometimes I sit and think through pain like, well, I went through labor. That was painful, and I didn't need medication. So at what point exactly should I take painkillers? Is it when the pain is more than the labor pain, or is it when the pain is less, or is it, how do I define all that?
So, Irene, female or women usually experiences more pain than the male counterpart.
Yeah.
The labor pain is the worst kind of pain one can
Yes.
have,
Agreed.
and almost every woman goes through that pain.
Yes.
And they sense that pain, they feel that pain, and they experience that pain. And now, in front of this pain, in comparison of this pain, other pains are relatively lesser. So
Yes.
females in general have more capacity to bear pain, and they neglect their pain.
Yes.
Yes,
Agreed.
yes, yes. Females are stronger than the male counterpart.
Yeah. Well, not, yeah, we can bear that, we can bear the pain much longer than our male counterparts. And I'm not sure how healthy that is. Is there, I'm sure there are some, dangers around masking pain for too long. As you said, pain is, one of the ways the body responds to many things. So if we keep masking it, for example, before I went for physiotherapy for my shoulder, I was just kept thinking, it will go away. It will go away. Let me do this. Let me do that. And kept masking the pain. And by the time I was going to be seen, and the first thing they said was, you should have come earlier, because now we'll need to do more for you because you did not do the right thing at the right time. And this is by virtue of self-medication. And this is me reporting myself. One, because I am, I have a medical background. So also as medical people, we tend to think, well, I can just prescribe this for myself and, take it and I'll be fine. Maybe that's also an issue.
So your last concern I'll take first. So, medical person or non-medical person. When a medical person become a patient, he or she is a bad patient.
Yes.
So usually we neglect
Yes.
our health. So that's where danger lies. So when you are not accurately diagnosing, where you are not accurately, appropriately treating your condition, and you're just simply popping a pain pill.
Yeah.
So this is a real danger, and one should not do that.
So for how long should you bear the pain before you seek help? Like, if we are trying to not take them randomly, should I just feel pain for 2 hours, go to hospital, or 5 days? How long?
So one thing I want to tell here to you is, you should not, the pain is an indication for an underlying disease.
Yes.
And if this pain persists, then definitely you should consult your doctor, go to a medical service, and get your condition accurately diagnosed and treat it appropriately. So let's say if you have occasional headache and it does not require much of the medicines and on and off, maybe a paracetamol, then definitely, and once you go to a doctor and doctor says nothing is wrong with you, then definitely you should not worry. But if this pain persists, it requires regular pain relieving medicines, then definitely this is time you should get into contact with a doctor.
Okay. So do you think you can tell us what are some of the safe, quote unquote, pain medication that, we can be able to access? I ask this because, like, I'm not sure how it works in India, but in Kenya, we have all these pharmacies around, and I'll walk into the first pharmacy and I'll be like, I want better pain. And the first pharmacy will sell it to me or say, no, I can't sell it to you unless you have a prescription. Then I'll say, okay, you don't want money? Fine. I'll move to the next one. And the next one, because they're feeling like, I need money, they will tell you, oh, you want better pain, how many? And they give it to you. And, it's different across. There are pharmacies that have good practice, and those pharmacies are very few and, high end. And then we have all the rest that are just trying to make money and a living. So they will sell you anything they can sell you over the counter. So how do we manage that? If I'm going to ask for painkillers, what should I ask for?
Yes. So there are two parts in your question again. One is over-the-counter pain relieving medicine.
Yes.
And second is which pain relieving medicines are safer. So over-the-counter, again, this problem is not unique to Kenya. This problem exists everywhere. Everywhere in the world, over-the-counter medicines, over-the-counter pain relieving medicines are available, and people take it and people consume it. So this problem is all over the world. Maybe some places this is less common, some places more common, but all in all, this problem is existing everywhere in the world.
Yeah.
Now coming to the second part of your questions, which pain relieving medicines are safer? As such, all medicines have their own side effects. Maybe some medicines have lesser side effects. Maybe some medicines have more side effects.
Yes.
Pain also has same properties. Some of the pain relieving medicines have less side effects. Some of the pain relieving have more side effects. But all medicines have side effects. So there is no absolute safe medicine. However, certain medicines are safer than the others. Certain medicines like topical pain relieving ointments, paracetamol, and tramadol, they have lesser side effects in comparison to other non-steroidal anti-inflammatory drugs. And they can be used whenever required, when in certain situations, like when non-availability of the medical services. In those certain circumstances, these medicines can be used for a short period of time to self-manage the pain. However, again here I will emphasize that you should visit a medical specialist as soon as possible, and don't self-medicate.
No self-medication. Agreed. So I have only one more question, and then I think I'll hand over. So I'm just concerned, I'm curious about people who are handling chronic pain. I have a few clients, people who've already gone through hip replacement or knee replacement, and they're constantly in some sort of pain. And I don't know whether that's pain they're going to live with forever, or that's pain that will will reduce at one point. So at what point do they say, this kind of pain, I can handle it because of the kind of surgery that was done? Or, after however much painkillers I was given, now I just need to figure out how to manage my pain or mask it. That's a real concern, because I have so many of them asking, so I have this knee problem. I've already gone for knee replacement and all that. I still am in pain. So what am I supposed to do?
I think this problem is a real world problem. Your concern is very valid. Post-operatively, many patients, even studies say that up to 20% of the patient post knee replacement and post hip replacement, they can have chronic pain. And this is
Yes.
entirely a long list of reasons why post-operatively patients have pain. So some of reasons which I enumerate here. Number one, how post-operative pain is managed in immediate post-operative period.
Okay.
So if in immediate post-operative period pain is managed well, then this pain there will be less chances of consistent pain in a later period of post-operative period. So it's very important to adequately control pain in immediate post-operative period. And I am very particular about that my patient should not have any pain in immediate post-operative period. So whatever medicines I have to use, I ensure that there is very minimal or no pain in post-operative period. So people who have less pain in immediate post-operative period, they have less chances of persistent pain later on.
That's something I didn't know. Now I have learned something.
Yes, this is maladaptive pain. So because of persistent pain stimulus, the brain remodel itself, and then this pain itself become a disease. So without an underlying disease. So this you have to treat it very aggressively, and this pain can be treated by various medicines like gabapentin, pregabalin, and many more medicines which can be used.
Yeah.
So, but to prevent this pain, immediate post-operative period should be pain-free. So that's a way you can prevent it. There are many other reasons of post-operative pain, like somebody has pain in spine and you have solved one problem, the problem of hip or knee. The spine problem is still persisting, then it can have pain. But this pain has a reason where the etiology is lying somewhere else. Then you can have many medical conditions which can coexist with osteoarthritis. They can also contribute to pain, like diabetic neuropathy, neuropathy associated with various other diseases. They can also contribute to pain. But the foremost thing to prevent post-operative pain is control pain adequately in immediate post-operative period. This post-operative pain can also because of faulty positioning of the components of the hip and knee replacement. So these two things I have in my control. That I will perform accurate surgery, very precise surgery, and I will control it in immediate post-operative period, so that a person will not have persistent pain in post-operative period.
Thank you. That's I've actually learned a lot there. I've learned about that at one point pain stops being a symptom and starts being a disease if you don't manage it the right way, which then becomes another issue altogether. Okay, I'm learning. So now I'll hand over for the second part so that we can stay within our time.
Yeah, yes, really questions were very relevant. Thank you for asking these questions.
Okay,
so Irene has been pinpoint on many things. One biggest learning for me that women are definitely more strong, not generally strong, but even stronger at handling pain. So that definitely needs a thumbs up. So that's fantastic.
Power.
So For all our friends who've been viewing this session, I'm sure next time you pop up a painkiller, you'll think twice that do I really need it, or it's going to do any changes to my body, right?
Mm-hmm.
So I'll go ahead with the second part of it, which is obviously less important, but we thought it's important for us to touch upon this so that we cover the whole gamut of pain management. Dr. Daria, I've been reading about endorphins. So does our happiness play any role in managing pain naturally? And what exactly is this endorphin? I mean, what does it do to our body? What is this hormone all about?
Himanshu, in my definition of pain, I stated that pain is an unpleasant sensory and emotional experience.
Right.
So happiness is pleasant emotional experience. So this is opposite of pain. So if a happy person, so a person who are happier, they experience less pain. And similarly, endorphins. Endorphins are naturally occurring pain-relieving substance in various parts of the spinal cord and brain. And these endorphins are the level of these endorphins are higher in people who regularly exercise, who are happier, who are optimists. These people have higher endorphin levels and they experience lesser pain for a particular noxious stimuli. So it is very important to remain happy, to have lesser pain if you have any noxious stimuli.
Thank you, Dr. Daria. So Dr. Daria has given us a tip that if you want to reduce pain, exercise, stay happy. Obviously, being exercised is in our control and possibly staying happy too. So I'll try and follow that and exercise. Let's see what happens to the pain. Next question, like a lot of our patients ask, does physiotherapy really help, or it's just moving of limbs that somebody is doing and we are paying for it? You think it makes a difference to pain when done properly?
So Himanshu, you are an avid cyclist. You cycle, you do cycling almost 30-40 kilometers in a day. So the day you do cycling and on the day when you don't do cycling, do you feel any difference?
Yeah, definitely. I mean, there's a huge difference, definitely.
It's huge difference. So this proves that the exercise play a very important role in promoting and maintaining health.
Right.
People who exercises, they have lesser chances of injury. They have lesser chances of chronic degenerative disease like osteoarthritis. In situations of pain, physiotherapist has many modalities to deploy, like ultrasound, heat and cold therapy, the transcutaneous electric nerve stimulation, etc. This reduces the pain and minimizes the requirement of pain relieving medicine. There are certain
actually I can be able to talk to that, because before I never even knew that there was anything about physiotherapy to handle pain. I know there's physiotherapy for, joints and, the hospital kind of physiotherapy for inpatients and all that. I had never, ever thought there was something about sports physiotherapy. Then I, with my shoulder, and I had this shoulder immobility and all that, I ended up in one place. And I can tell you for free that physiotherapy definitely helped to relieve pain. I left there within my first session. I was able to make some movements that my hand could not make for the longest time, and pain was markedly reduced. And so, yeah, physiotherapy works. It does. The only difference is probably people don't, when we hear physiotherapy, we think of, being sick in hospital and I can't move my joints, or I can't walk, and this person is coming to do all sorts of things to you. That's what we define as physiotherapy as the lay people. But apparently there's that definition for sports and pain management and all that. Yes.
Yeah. Thank you, Aaron, sharing your personal experience. This is very helpful to all our viewers. So I was actually coming to that point only.
Oh, okay.
So there are certain conditions which are because of the certain pain of musculoskeletal pain, which are caused by muscle imbalance. And if you properly, if you properly design a physiotherapy regime or exercise regime and then follow that regime, your pain can be completely cured without any medication.
Okay.
Wow, so that's a fantastic news. So all our friends, you want to save your liver, kidney, digestive system, and you are in pain, give a try to the physiotherapy. You might be able to shine bright.
So Himanshu, I want to add one more thing.
Yeah, please.
So chronic conditions like osteoarthritis, the degenerative osteoarthritis, if you do proper exercises, if you do supervised physiotherapy, then the pain because of this chronic degenerative disease also decreases dramatically, merely by doing exercises.
Wow.
Yeah, in fact, I must mention here that like for all the patients you operate, you do not operate them immediately. You give them a week or 10 days to do some exercises and then come back. So the muscles are strengthened. That helps them recover quickly post-operatively. So definitely that's an interesting practice to do.
Yeah, that's definitely interesting.
So I will go ahead to the real problems which we face nowadays. Thanks to the global pandemic of COVID, we have a lot of our patients who are in Africa, especially with you around. You've lots of them you've treated from all around the world, especially the African subcontinent. How have you been managing them? Because they must be coming up with queries to you, questions to you that, okay, I have pain or I have discomfort. Can I do this? Can I do that? How do you manage that?
This question to Irene or this question to me?
You. It's for you.
Okay.
Dr. Daria.
Yes. So, Himanshu, this pandemic changed the whole world. How we work, how we do things, completely has been changed. The main intervention which we can do to reduce the spread of this pandemic is social distancing. So in the era of social distancing, the telemedicine has been brought into the focus.
Right.
And as you know, you are one of the pioneers of the telemedicine in India. You have started this telemedicine way back in 2003, and you have traveled across the country to kickstart this concept with the help of ISRO. So you know it better how telemedicine can be useful. To my understanding,
I just want to understand from you the effectiveness of telemedicine in terms of managing your patients online. So Irene also gets an idea because she will be our associate in Kenya to drive this further. So there would be people after her asking the information. That's why I put it across.
So with the help of telemedicine, in this pandemic era, many people are managing their health-related issues in consultation with doctors sitting at a distance, especially pain. This also reduces the use of over-the-counter medicines, which has higher chances of side effects. Timely consultation also reduces the unnecessary anxieties. So all in all, telemedicine is very useful in this difficult time of corona, and for both patient as well as for doctor.
Yeah, definitely. And having to, so like in Kenya, if you want to go and see a doctor, first of all, there wasn't that very refined way of I have to make an appointment. It's just that I walk in there. Problem, you walk in and then you come in at 12, you'll be seen at 6:45 p.m. It's a clinic, so it's consultation, and so there's nobody really who's going to give you first aid. You just have to wait. And then now with telemedicine, it's there's no that middle person for let me make for you let me write for you a card and then you wait for the doctor. No, you make an appointment and you get to speak to the doctor directly within no time. And then you get, you talk about your issues and you get, your prescription and you go and buy the medication, or it's even delivered to you. I'm telling you, this COVID may have been bad, but also very good because it has changed a lot of things. So yes, I totally agree with him that a lot of over-the-counter medication and self-medication really has reduced, because now people tend to want to speak to somebody before they go and buy something for themselves. People are still afraid to go to the hospital because you don't want to be told that you look like you have COVID, so come, let's isolate you a bit. Yeah, I'm saying it frankly because yes, people still say, yeah, they say, oh, I'm not going to the hospital. If you're sending me there, I am not going. If you have a solution for me that doesn't include me going there, that's fine. But if you're sending me there, no way. Yeah, so this gives that option for people who are afraid, so that they can get that very timely consultation that helps them to, get the right medication before things get really bad. Yeah.
Right. So Irene has put it across. We all are sailing in the same boat, almost similar situation everywhere, that there is a fear. But Dr. Daria, now I would wrap up this session quickly because you have been discharging your, thanks to this pandemic again, and innovations from Dr. Daria saying that he's discharging his knee replacement patients in just about a day's time. So if you can quickly tell me about your true align knee replacement technique and high performance hip technique before we come to the close of the session, so more people can be benefited by it.
So this true align technique aims at ensuring the precision in surgery, and that is consistent precision. So this is what true align is. So with the help of true align, consistent results, consistent precision, and minimal tissue trauma, minimal blood loss, and adequate pain control through latest protocols, we have reached a stage where we have enhanced recovery to our patients, and we can discharge our patient in a day after total knee replacement.
One day.
Regarding hip replacement, high performance hip replacement, the high performance hip replacement ensures full hip movement. It does not restrict any activities of life, and it lasts longer. So this is what we do.
Yeah, Irene, you were just asking. Yeah, it's like one day and one night in the hospital, and then the patient goes home for the knee replacement.
I'm asking because I have nursed a lot of patients. Yeah, I've nursed a lot of patients who have gone through hip replacements, knee replacements, and they stay. Yeah, 5 days, 7 I've seen. Yeah, even 10. So that's how I was like, I had one day, I had to repeat one day, like one day. Yeah, so that's impressive actually.
We're just trying to figure out it's a time that everybody needs to innovate. Had pandemic not been there, probably we would not be talking like the way we are doing right now. So there's a lot that has changed, right?
Definitely,
so
I know.
So I would just draw this session to a close. Thank you all the viewers for being our listeners. In case you have missed this session, don't worry, this is available. A complete recording of this session is available on social media platforms of Zydushospitals, as well as Patient Support Services Kenya, which is managed by Irene. Please do leave your comments, share your feedback, and don't forget to join us next Saturday, same time, same place, for the session on brain stroke. Brain stroke is the 3rd largest killer across the African subcontinent. So please be there. Asante sana.
Thank you.
Yeah, thank you.
To all my viewers.